Compared to the UK, working in the Isle of Man has really reignited my passion for pharmacy.
I worked here when I was a pharmacy student over the summer holidays. It was really nice to come back after I qualified.
Sometimes in the NHS it can feel a little bit like you're a cog in the machine just because of the demanding workload and such large departments that you're working in. But working in an integrated care system like Manx Care, you feel so much more appreciated for the work that you do. And that, alongside better rates of pay, the fact that the commute's shorter in the mornings due to less volumes of traffic, and the better tax rates, there's nothing really that you can complain about.
The best thing about working here is probably the commute time. So when I worked in the UK, I used to have to travel about an hour each way, whereas in here it takes me about 10 minutes to get to work and get back from work, so I can still do things in the evening after work.
Being a pharmacy technician is a very enriching job, especially in a hospital environment. Being the only hospital on the island, it means that there's new, varied roles coming up all the time, and you're able to find that niche that you want to work in.
I started as a Band 6 pharmacist when I first qualified in 2019. In 2020, I moved into a Band 7 role as a rotational pharmacist. After that, I was given the opportunity and funding to study a 2-year postgraduate clinical diploma, and I trained as an independent prescriber before moving to my current role in 2023 as a Band 8A specialist pharmacist. My role ensures that the patients are receiving safe and effective treatment while they're in hospital, as well as any additional monitoring or follow-up that's required.
A day of working as a pharmacy technician can really vary, especially in a hospital environment. I could be dispensing complex prescriptions for people. I could be preparing, manufacturing products in the aseptics department. I could be out in the wards, speaking to patients, learning about them and their experience with their medicines.
What I enjoy the most about my role is knowing that I have made a difference in the patient's hospital journey. I also enjoy working closely with the doctors and nurses and to be able to utilise my skills and knowledge.
The team is like one that I've never experienced before.
I work with a very professional and dedicated team.
We're a really tight-knit group.
All of my team members are very helpful and supportive. I can always rely on them and ask questions when I need help, and they will always be willing to help me.
One thing that really shocked me when I moved from the NHS to here was seeing that everybody sat down together at lunchtimes and ate together. That's just something that I'd never experienced before. Just that in itself on my first day, you just knew that the team was a great one.
We've got loads of beaches and walks that you can explore, so it's a really nice place to live in.